Next question is, how can we ban the use of fluoride in our city water supplies? And this is a multi-step process, and we have had a lot of success. Right now, the momentum is on our side. You can visit our website and see over 250 communities, primarily in North America, that have ended fluoridation in just the past decade. And it always starts with citizens, just like yourself, stepping forward and being advocates opposed to this practice, or advocates for safe drinking water. And so the steps, quickly, one is I urge people to join FAN, sign up for our bulletins. You'll get action alerts. You'll get the latest in science. You'll get the latest in talking points. You'll get everything you need to make a solid case. So follow us on social media. Again, you'll receive the latest science, the latest alerts. Step two, educate yourself about fluoridation. It sounds common sense, but a lot of people are so adamant about getting it out of the water, they immediately just go and start talking to the counselors before they've really solidified those talking points. So watch our 10 facts about fluoride video, the professional perspective video, our daily dose. These are all 20 minutes or so. They're short, and you'll gain a lot of information, and you'll get those talking points down. And we also urge you then dig into maybe some of these more specific videos, like our 4 game-changing studies presentations put on by our director, Paul Connett. And the great presentation that was just recently published by our science director, Chris Neurath, on fluoride's neurotoxicity. I mean, these are the key arguments you're going to want to make to your local officials. So educate yourself, learn those talking points, visit our state database to learn about your region. We have the specifics about each state broken down in our database. You'll find it on our homepage up under researchers. Click on that and you'll find the state database. You'll be able to learn about the latest fluoride news in your state, other campaigns ongoing in your state, or if your state has a state point person, a representative from FAN that you can work with, as well as other communities that have ended the practice. This is a great way to gain ideas on really how you want to implement your campaign, which is really the next step. The third step is find if any nearby campaigns are currently exist in your community. If there are people already working to end fluoridation, a good way to do that is you can either go to Google or go to our search bar on our website and search for the Worldwide Alliance to End Fluoridation. There's a list of campaigns, local campaigns throughout the United States and the world who have added themselves to this list, who have asked to be added to the list. And we have their contact information. If you find one in your area, reach out to the organizer there and ask to be part of that campaign. You can also search Google and Facebook or other resources for local campaigns that maybe haven't jumped on to our Worldwide Alliance, but still exist. They want to be independent, and that's fine. And you can just go to Google or Facebook and search keywords like fluoride free, and then your name of your town, or fluoride free and the name of your state, or fluoride against, or safe water, Milwaukee, or you'll generally find campaigns. Now, if you don't find a campaign, then I would say, let's move on to step 4. If you're willing to organize your own campaign, again, hundreds of people have come before you. They've been successful. It can be done, and I encourage people to do it. Then you're going to want to organize locally. And the first step, the first step in organizing locally is to understand who has the authority to fluoridate, who has the authority to initiate or to end fluoridation in the community. It's the number one question I see people running into when they reach out to me and they want to initiate something. I say, well, every community is a little different. Does your community require a referendum, meaning a vote at the next election? Can a unilateral decision be made by the mayor or water director? Do you have a public health board that's making this decision? Or does the city council make the decision? You have to first establish this for us to move forward. And a good point of contact to gather this information is to do a little research. Again, if you go to our state database, you'll find it generally in the news section. But do a little research on what debates over fluoridation have happened in your community in the past. That will generally give you a good idea of how it was implemented and how people have tried to end it. Also, on that state database page, it'll tell you the state law in your state. Some states mandate fluoridation, and so at your local level, there'll be little that you can do to end it without a bill. And so it's important to know that. And if those resources you still don't have an answer, call your city clerk, contact your city council member and ask them. I mean, this is their job. They represent you. They should be able to tell you the process. If all else fails, at this point, if you're adamant about organizing, you've educated yourself, then reach out to me as the campaign director at Stuart, S-T-U-A-R-T, at fluoridealert.org. You can email me, and this is where I can jump in and walk you through that process of figuring out who has authority, if you haven't been able to figure that out yourself. And then we start working on strategy. This would be step 5. After you've reached out to me, you've done the groundwork, we start working on strategy. And generally that means, if it's a city councilor or it's a unilateral decision by, a mayor or a water director, we lobby these individuals behind the scenes. We try to educate them. We get the information in front of them, and we create a champion who can then take our issue to city councilors or to the health board to get a resolution passed. What happens beyond there is typical grassroots, and and that's where I would urge you to reach out to FAN. There's not something that we can really express in a brief video like this, but at that point where you've educated yourself, you understand the path that must be taken, and now you're looking for a strategy and for lobbying materials and for help with professionals, finding professionals to speak out in your area. That's when you reach out to FAN, and we will do our best to offer you those resources and walk you through that process. That's what we do. So, and I would just add that we did receive also a lot of questions, people asking, in regard to this trial ruling, when will fluoridation end? And I would say to you, don't wait for a ruling. You can end fluoridation as quickly as a month or maybe in the next year or two. And I say month because if you live in a very small community, you know your city councilor by first name, or they know you. We have seen people with very small, citizen groups go and educate a champion on the city council and just educate them. You don't need to be it doesn't need to be very public at this point yet. Just go as you would a constituent with the studies, with the concerns, show concern, and educate that champion on the board, and they can then bring it to the council, or they can, as a mayor, make a unilateral decision. And we've seen that happen in the course of 1 or 2 council meetings, generally in very small communities where the councils are very representative of that small group of people. The larger the community, the greater chances you're going to need to do grassroots organizing and have a campaign behind you. And of course, in those instances where a referendum is required, that's where I would tell you as a campaign director, you're going to need to find other co-organizers, and you're going to need to take some time. It's going to take a year or so, or 6 months to a year, to develop a campaign, because you're going to need to educate this community prior to that vote. Just getting a vote won't be enough. You'll have to there'll be a massive education effort. But again, we've had lots of communities that have had success with that. So don't let that be a deterrent. So I hope that helps answer that question.